Good. We press it down. Big breath in. Hold your breath. Better. Great job. Good. Okay.
COPD stands for chronic obstructive pulmonary disease. It's a chronic and progressive condition where lungs develop holes over time and the windpipes constrict, and together they cause shortness of breath for patients and coughing spells that lead them to see urgent care in hospitals and physician offices.
I've known some of the members since the initiative started in January of 2012, and they immediately saw where the greatest good was to be had, which was really in this very challenging population. You know, they really went out and reached our patients that are the most marginalized.
We do a good job of treating patients in hospital for their acute lung attacks, and when they're ready to go home, we discharge them. However, because COPD is a progressive and chronic condition, they have to manage their condition at home.
Alexis and I like to go to the downtown east side together. We do rounds, usually every 2 weeks we'll go down as a team and see the patients, and they're very, very receptive to our interventions.
98, 90,
So 97 and 75. So 97 actually is the level of oxygen that's in your fingers here, which is excellent.
I think that we've been very fortunate to be able to play a major role in improving the quality of life for a number of these patients who actually had no support, no services at all in the community. And many of them very isolated, disenfranchised, and living in appalling conditions.
So my role in the COPD outreach team is I'm the respiratory therapist. So initially when I started this program, I thought that what it was we would go to people's homes and we provide COPD education. So do a respiratory assessment, check their inhalers, make sure they're doing it correctly, go over some techniques for breathing, for coughing. We do that, but it's more than that. And what happens with COPD is you get inflammation of the airway tissue, okay? The muscle around the airway gets tight. We're going into these people's homes, we're seeing what their living conditions are, and we can almost realize why these patients might get sick again and come back to hospital.
Number one is quit smoking, absolutely. That's the first thing your doctor will tell you.
I feel very fortunate to have this kind of a job where I'm out there in the community and use a lot of creativity and a lot of tremendous amount of compassion and ingenuity in sort of trying to connect with folks that don't have phones, they don't have you know, any other way. None of them have computers, or it's not like you can just email them and connect that way. You have to be very creative about how you connect with them.
This team is all about connecting. That's what we've done from day one, as we had to learn about everything within the hospital, within the community, and the patients' lives, and how we can best adapt our care to fit their lives and fit this unique population that we have here at St. Paul's.
They're motivated, they're self-starters, they think outside the box. So really this team was sort of given a goal and they've run with it, and you know, I think that's why they're so impressive, the work that they've done.